Hello dear student, this is Dr. Sehar from DENTABEST, your best online mentor for the preparation of INBDE, ADAT and afkexam. Please subscribe to my channel on YouTube and follow me on Facebook, Instagram, LinkedIn and TikTok. Please do visit my website at dentabest.com where I'm offering different personalized and self-study smart learning programs at a very affordable cost for all my hardworking dear students. So the topic of the video today is pharmacology, right? So pharmac is a subject which many students, they find it difficult. So let us try to dig in and see what are the important concepts, what are the important topics we need to prepare for pharmac, INBDE, ADAT and AFK preparation. Okay, so the first class or drug we are discussing today are definitely the antibiotics we have. So antibiotics are a very important topic for exam, especially the drugs like penicillins, right? The cephalosporins, your drugs like macrolides, tetracyclines, that you prescribe very commonly in your dental practice. They are of course very important. You always have questions on them. So the first class of drug we are seeing here, they are the aminoglycosides. Okay, so the drugs that come under this group, we have streptomycin, we have gentamicin, neomycin, amikacin, right? They're all under aminoglycosides. Now, they mainly act on the gram-negative bacteria and they work by inhibiting the protein synthesis. 30S ribosome, they are inhibiting in the bacteria. So the bacteria don't divide, and that's how it is finally stopping the growth of the bacteria. While cephalosporins, they are a very broad spectrum. They work both on gram-positive and gram-negative, and their mechanism of action of cephalosporin is same as penicillins. Both of them, they inhibit the cell wall synthesis in the bacteria, and cell wall is a very important component of bacteria. So they are blocking the enzyme which is called as peptidyl transferase enzyme. This enzyme is very important in the last step of cell wall synthesis and help in cross-linking of the molecules. So they are blocking this enzyme, cell wall is not synthesized, and basically the bacterial cell is going to get killed. So both your penicillins and cephalosporins are going to be bactericidal. So firstly, we understand some medications here are bacteriostatic, that will stop the growth of bacteria, and some of them are bactericidal, like your penicillin, cephalosporin, they are bactericidal. So they are going to kill the bacteria. The next group we have are the tetracyclines. We know that tetracyclines, they are used very much for the perio conditions. The reason is that tetracycline is going to inhibit the collagenase enzyme of the bacteria, and that's how it stops or inhibit the bone loss in perio condition. So tetracyclines we have doxycyclines, and they work by inhibiting the protein synthesis 30S of the bacteria, the ribosome. Then we have sulfonamides. Sulfonamides are not used in dentistry. They are mainly used for the UTI, but they work by inhibiting the folate synthesis in the bacteria. Folate is a very important compound that is required for synthesis of DNA. So if the DNA is blocked, the cell is not going to multiply. Then we have fluoroquinolones, like we have ciprofloxacin, levofloxacin, that comes into this group. They work by inhibiting the DNA replication by blocking one enzyme called as DNA gyrase enzyme. Then we have the macrolides. Macrolides, they also work by inhibiting protein synthesis in the bacteria. They are bacteriostatic, and they inhibit the growth of bacteria by blocking 50S ribosome of it. So macrolides, we know the azithromycin, clarithromycin, erythromycin, which are the second drug of choice for penicillin allergic patient. They are the macrolide, because we know first drug of choice for penicillin allergic patient is going to be cephalosporin, as I already explained in the last video. The other group, which are the more newer antibiotics we have, which is carbapenem, which also inhibit the cell wall synthesis in the bacteria. So it is also come under the beta-lactam antibiotics, like penicillin, cephalosporin, carbapenem, they all come under beta-lactam antibiotic. They have a beta-lactam ring in their molecular structure, and that is very important for their bactericidal effect. Then we have lincosamides and glycopeptides. So they are again very important